Okay guys, we show this all the time, but this is a great illustration today of what diastasis is. So she's gonna scroll down here and show you that this is a six-pack muscle here. This is a six-pack muscle here. Very, very, very loose. This white gap right here is the diastasis. So if I take the Bovie cauterization, I can show you this is the edge of the muscle contracting, but in the midline, it doesn't contract because that's the connection between the two muscles. So
that was fascinating. Diastasis recti, also known as divarication of the rectus sheath, is where there is a separation down the midline of the abdominal muscles. The connective tissue in between, which is called the linea alba, stretches and thins. Now, it commonly happens during and after pregnancy, but it can occur in anyone with increased abdominal pressure, for example, those people with obesity. Now, you'll usually notice a bulge or a doming down the center of your tummy, especially when you're sitting up or straining or coughing. Small diastases after pregnancy usually resolve within the first couple of months after birth, with physiotherapy and rehab being the mainstay of treatment. Now, this would involve activating the deep muscles of your core, strengthening your pelvic floor, and working on your posture. It's also important to avoid doing things like crunches, sit-ups, and heavy straining, because the goal is to rebuild the tension in the linea alba so that the muscles can move closer together, and that will help the core to become more functional again. Surgery is usually reserved for severe cases with functional impairment or even for cosmetic reasons.